All right, I will go ahead and get us started. Good afternoon, everyone. Welcome and thank you for joining us on this webinar, PHE Unwinding Check-in, Stay the Course or Time to Pivot Your Plan. My name is Shug Pierce. I'm a project associate on the Process Innovation team at APHSA. Next slide. APHSA is a bipartisan national membership association. We represent state and local health and human services agencies through their top-level leadership, and we seek to influence modern policies and practices, help our members build capacity for their team, and connect them to other human-serving organizations and policy members. Okay, next slide. All right, so I said that. I got a little bit ahead of myself there, but that is okay. Right, so then we can go to the next slide. APHSA has a couple of conferences coming up soon. So registration is currently open for Economic Mobility and Wellbeing Conference in late August, and ISM and PHSA Education Conference in early September. And then registration will open soon for our NSDTA Education Conference held in late October. So we hope to see you there. And then with that, I will go ahead and pass it to Blake to get us started.
Good morning, everyone. My name is Blake Shaw with the Change and Innovation Agency, and I'm honored that you have chosen to spend an hour with us today. I just want to set up where we're going. So on March 9th, for any of you that were there, we hosted a webinar to talk about how states were preparing for PHE Unwinding that was going to begin on April 1st. And of course, they hadn't just started there. They had been, many of them, working for a year. But, you know, the big thing is we all had collectively 84 million-ish folks to renew with Medicaid services. And some of those agencies straight on Medicaid determinations, some of them bundled with the very same folks making SNAP and TANF determinations. We're also responsible for those Medicaid renewals and determinations. And so at the time in March, we had Connecticut and Missouri, and then the Center on Budget and Policy Priorities join us just to give, the national perspective, where we really asked about what have your plans been? How are you addressing specific areas? And so the first one was, how are you communicating with your clients and your customers, pre-PHE Unwinding? The next was about people and process. How are you, preparing your people and your processes for the unwinding that is about to unleash, for the states and counties that had chosen to hold the renewals. So we had really interesting conversations there around, how people were shifting, what kind of model were they using? Were they utilizing, contracts or all state staff, or were they utilizing a hybrid model for approaching the work? What were they doing in the area of training up their folks? Because the point was made that some of their staff had not ever done a Medicaid renewal because they had been hired within 3 years. We discussed technology and systems, how were folks preparing their technology? Obviously, passive renewals, ex partes were a big part of that conversation. Then around data, how are we tracking data? How are we preparing to report data to CMS? And then policy and budget takeaways. And what we're looking there for, have you shifted policy? And we got into some labor conversations. How are you utilizing budget dollars to prepare? So today, we have another group, because the vision of these webinars was to follow, some of your colleagues and peers through the public health emergency unwinding. And so today, we have Missouri back, we have Center on Budget and Policy Priorities back, and Nevada was going to join us, and we'll talk about that in a bit, but they're going to share today about those same issues, but how was their planning, right? What has gone smoothly for them in the first 4 months of the unwinding? What has been a surprise to them? if they were surprised or something that they weren't expecting, how are they shifting gears? And so what we're trying to do is give you a chance to hear from your colleagues. And the other thing I want you to do through this webinar, as we discuss things such as, is backlog growing or is it not, and how are you handling it? Please utilize the chat for your questions, because the way we've planned this hour is we're going to leave time at the end to actually go through questions and see what our panelists can speak to. And our commitment to you is, if we don't get to all your questions, we will send a follow-up when we send the slide deck with unpacking some of your questions a bit more. So with that, I'm gonna get us into the panel. So next slide, please. Well, there's what I just told you we we're going to do. So next slide. Like Shug, I got ahead of myself. All right, so today on the webinar, we had Kelly Cantrell, who's the Deputy Administrator for Program Field Operations for the Division of Welfare and Supportive Services with Nevada's Department of Health and Human Services. Unfortunately, for Kelly, there was a last minute, family emergency. And so she is right where she needs to be, but had to withdraw, at the last minute. And so we'll be thinking about her, and she has agreed to come into the next one for us. Next, we have Melissa Wolf, Deputy Director, Family Support Division for the Missouri Department of Social Services. And I'm just going to ask Melissa if she would take a few moments to talk about herself a bit.
Thank you, Blake. Melissa Wolf, I am the Deputy Director for the Family Support Division, which under my purview would be all of the policy for SNAP, TANF, and Medicaid. It would also include our Administrative Hearings Unit. It would include training, our quality assurance units, so those case reads that happen before follow-up from our federal partners to kind of look at those errors and find some trends. Also taking on a little more active role in processes and just how we navigate through the PHE unwind. It's a heavy lift for all of us. So just taking a little more active role in some of those processes and some of the things the field or our eligibility workers have done over and are going to be doing over the next few months.
All right, thank you, Melissa. Next is Jennifer Wagner, Director of Medicaid Eligibility and Enrollment for the Center on Budget and Policy Priorities. And the great thing that I notice about Jen before she shares about herself is she has such a great national perspective, because CBPP is working and communicating with both states, counties, and with CMS on a daily basis. So I always like to have her shed light on what she's seeing, not just in Missouri, not just in Nevada or Connecticut, but what she's seeing nationwide. So Jennifer, good morning.
Hi there. Thanks so much, Blake. My name is Jen Wagner. I have background as a food stamp caseworker, a state advocate, and oversaw policy and operations for a state before coming to Center on Budget about 8 years ago. Here at CBPP, I look at the on-the-ground policy, operations, and technology that affect access to benefits, focusing on Medicaid, but also looking at SNAP, TANF, and WIC. When you think about policy, operations, and technology, obviously that is the crux of what's happening during unwinding. So as Blake said, we are working very closely with advocates, state agencies, and federal agencies to do everything we can to make sure that eligible people stay involved.
Great, thank you, Jen. And then, myself, President of Change and Innovation Agency. We have been a firm since 2003, focusing specifically in human services since 2006. And so, I really appreciate you joining us. And without further ado, we will get into this. So next slide, please. I want to start with the national perspective and what we're seeing with, from Jen Wagner's standpoint of view. But what I will say is, I want to start from my standpoint with the good. Already millions have been renewed. Okay, and so that is great work. Obviously, there's a lot of work to do. This is an unprecedented time for you all. So we cannot lose sight of all the good that is happening out there. Next slide, please. We also know there are a few issues in terms of, headlines that we see around pausing different pieces of the unwind, for procedural reasons. But again, it's likely a healthy pause because we're catching things, 3 or 4 months in. So catching them 3 or 4 months in allows states and counties to redirect and make sure that they're on track with helping the folks that are in need in their communities and in their states. So with that, I'm going to ask Jen if she'll just tell us from a national perspective, shed some light on what she's seeing from a positive standpoint, and then what she's seeing on as areas of focus moving forward. So Jen, would you go on with the next slide, please?
Sure, thanks so much. And like Blake, I want to start with some of the positive developments, because when we look at this eligibility enrollment process and the on-the-ground experience of people seeking benefits and renewing benefits, there are a ton of improvements happening. And state and county agencies have made tremendous strides in really upping their game to deal with unwinding. And the good thing about this is that it's not just for unwinding. These developments, these lessons we're learning can continue beyond unwinding and help serve people well in the future. So one of the first positive developments is data transparency and analysis. As we know, the Consolidated Appropriation Act required that states report certain data to CMS and that CMS make that data public. But many states are publishing their own data on their websites. States have created incredible dashboards that really dive into the process and what is leading to renewals and what is leading to terminations. And the fact that that data is public, the fact that we're able to start comparing across states is leading states to pay more attention to their own data and do analysis, recognize areas for improvement or where they're maybe out of line with national partners or with other state partners. And that's really exciting to see people sharing this data. We're learning a ton and looking at their own data to try for improvements. And we expect that to just continue. As many of you know, CMS is expected to release their first tranche of data on a national level on Friday, which will give us a whole lot of additional information and insight and set the stage for monitoring throughout the rest of unwinding. In addition to data transparency, we are seeing tremendous efforts by state and local agencies on communication and outreach, really innovative methods to try to reach people, recognizing that many have moved during the pandemic. Agencies are using texting like they never have before. They're doing door-to-door outreach, advertisements, bus wraps, billboards, all kinds of efforts to really try to reach people. And I think we're going to have a lot to learn as far as what's most effective among those strategies and what of those we can carry forward post-unwinding. We're also seeing tremendous partnerships with managed care organizations. These MCOs, of course, have an incentive to keep their members enrolled and help them successfully renew. And in many cases, they have additional capacity and agility that sometimes state and local agencies lack. And so many states are partnering with them, giving them data so that they can do outreach about folks who are due for renewal, giving them data about folks who lost coverage so that they can do follow-up and try to re-enroll them in coverage or help them transition to marketplace. So leveraging that additional capacity of the MCOs is another thing that's helping during unwinding and has potential for the future. And finally, states are making great effort at reaching people. So taking address updates from additional sources, like the National Change of Address database, processing returned mail as required by the CAA, not just taking it and putting it in a pile off to the side, but making affirmative active outreach efforts to try to connect with people whose mail is returned to help them complete their renewal form. And so again, a lot to learn there about that development. On the next slide, there are a number of concerning things happening as well. So looking at that data, we're seeing very low ex parte rates. As most of you know, ex parte is the automated determination process using electronic data sources that is supposed to happen before a form is sent to a client. And previously, we had some state reports of what their ex parte rates were as part of the Kaiser Family Foundation survey. But those were self-reported and there wasn't always a consistent definition of ex parte across states. Now we are seeing kind of whole numbers in the CMS reports of how many clients are being renewed ex parte. And this includes some previously excluded populations in some states, like the non-MAGI population, or Medicaid recipients also receiving SNAP. And these rates are lower than we expected. Some are doing great. A number of states are above 45%, but we have others that are under 10%, under 5%, under 1%. And so that's really a huge area for improvement to keep eligible people enrolled and reduce agency workload as well.
Yeah. Hey, Jen, can I ask you a question on that?
Sure.
With ex parte, first is the first thing because I hear people defining it in interesting ways. So first, could you define how you're looking at that? Is it in 24 hours? Is it immediately? The second thing I was going to ask is, and I think you addressed it, but are you seeing low rates, or where you are seeing low rates were they predicted to be higher, or is it just the percentage of folks under 20, under 15, under 10% is alarming at this point? Could you unpack that a little bit?
Sure. So ex parte rates are renewals that are completed by the agency without requiring the client to send in any additional forms. So it's kind of similar to real-time eligibility on the front end. And I think that's what you're referring to, Blake, with within 24 hours of processing. Yeah. But this is something that does not require a client to return a form. So in many cases, it's done automatically as part of the eligibility system. But we also have seen states be very successful with some creative approaches where the caseworkers are manually completing the ex parte by looking at electronic data sources. And we didn't really know what to expect. I mean, again, we're comparing some things to what the KFF survey revealed pre-pandemic, but there were so many changes in practice during the pandemic. And fortunately, there's been a lot more attention to this issue, with CMS putting pressure on states to make sure that they include all populations. If their system can't do it, make sure there's a manual process, and a lot more effort around this. So we still expected it to be higher. There's a lot of variabilities. For example, if a state is prioritizing those that they've identified as likely to be no longer eligible, you'd expect a lower rate. Some states that are doing this manual process, that isn't always captured in the ex parte data they're reporting to CMS. So a lot more to work through there, but in general, these rates are lower than expected. And the fact that we have some states with really high rates demonstrate that it is possible, and that there's work to be done to bring up those other states to that rate in order to keep eligible people enrolled and reduce workload.
Okay, thank you.
Mm-hmm. So kind of a counter to that in a way is we're seeing very higher rates of procedural terminations. These are folks who are not being found ineligible because they've got higher income or are no longer categorical eligible, but because they have not submitted their renewal form. And these rates are incredibly high, and this kind of increases the need for attention to ex parte rates, because if you ex parte somebody, they don't have to return a form and they won't run the risk of being procedurally terminated. So we anticipated these rates being substantial. They, I think, pre-pandemic were, although we never had good data on it. For folks working in SNAP and other programs, I think there were predictions that they would be a little bit higher than some people expected. But we're seeing, 50, 60, 70% of the denials and of the overall renewals resulting from procedural terminations, which is very concerning. We're also seeing a number of agencies developing backlogs. We know that some states and local governments were struggling to keep up with applications before the pandemic provisions ended, before Unwinding began. And if you take folks that were hardly keeping up before and add tons of renewals on top of that existing workload, it's not surprising that some of these backlogs are developing. But a number of states are not processing very many of the forms that are returned, and each month carrying over a pretty substantial backlog. Good news, of course, is that in Medicaid, benefits should continue until the agency is able to actually process that renewal. And we think that's happening in most states, which is good, but it does create a lot of confusion for individuals on the ground who may not know if they have coverage month to month or not. And obviously that big of a backlog affects call center wait times, customer service issues, et cetera. So that leads to the next topic on call center issues, where we are seeing high wait times, confusing IVRs for people to navigate and try to get through to, sometimes some misinformation or disconnections as people are trying to call. They should be able to renew over the phone as well as online and by paper, and that's not happening in all states, so that's kind of concerning. Blake, did you want to jump in with a question?
Yeah, but go on to your last one and then,
okay.
And then I'll do it because I wanted to ask Melissa some things about this as well.
Sure. The final area of concern is around notices and language access. So many notices are very confusing. We know that Medicaid policy in general is confusing, but some are kind of crossing the line from confusing to a little bit nonsensical. And so that's something that needs to be addressed, as well as language access issues with notices not being translated into multiple languages, those translations being problematic, and even difficulty when people are trying to access service in person or through call centers and not experiencing the language access that they're entitled to. So as you'll see, a lot of these things are kind of longstanding issues in Medicaid. There are a few new ones that are very unique to unwinding and the fact that people haven't renewed for a few years. But these are all issues that have been prevalent for a long time in Medicaid. And the positive spin on this is that unwinding is really bringing increased attention to it. CMS oversight of states and accountability has increased tremendously. Exposure of these issues, looking at the data, has increased. And so we've got to, make changes as quickly as possible to protect eligible people and reduce those procedural terminations, especially. But hopefully, if we're able to kind of work through all these challenges of unwinding, we're really going to set ourselves up to be in a better place post unwinding.
Thank you. Yeah, and you said something that right there too, you followed up and was really interesting to me was are these issues that have always been there, but now that we're paying attention, to the data, meaning you all on this webinar, we're always paying attention to the data. It's just, it's a very heightened, magnified sense of visibility right now. And so, Jen, the thing on the procedural terminations, I know we had this conversation, and then I've talked to others clients of ours who about this is, did they always exist, at a high rate, or or is there something else wrong, but now we just see it because of the data? And so I wondered, Melissa, your perspective on that as well, and Jen, you as well, because part of it is to go in and say, well, this state is performing horribly, which is, by the numbers maybe, but it's not entirely fair when it might not be that much worse than before. It's just we're paying attention. And so that's what I'm trying to get at, to see if that's got any weight to it. Yeah.
Sure. I think that's true, but it doesn't mean that before was acceptable. I think that's what we have to keep in mind.
Yeah.
That there is more attention to these issues. And even if it's only marginally higher than the procedural terminations were before, that wasn't acceptable before. We just didn't know about it the same way that we do now. And so we need to make sure that we don't accept the kind of status quo or business as usual of tons of eligible people losing coverage. And we need to look at why people are losing coverage and how many of those do continue to be eligible. So that includes looking at measures like churn, looking at application volume. The month after a high number of procedural terminations, did application volume spike, which indicates that a large number of eligible people lost coverage. And why was the form not returned? Did they not receive it? Did they not understand it? Did they send it in, but the agency not process it timely? So again, this attention is helping us kind of dig under the surface and hopefully remedy those issues, whether those are kind of newer and unique to unwinding or have been present for a long time and problematic for a long time, but now we have the opportunity to truly address them.
Right. And I was, back at on the back end of the Great Recession, there was a study out that talked about, I think it was 60 to 80% of folks that do not renew are back in the door, within 3 months time. And so that churn factor is I think incredibly important to help diagnose what's going on. But Melissa, anything to add on the question about the data and the terminations?
So I completely agree with Jen. It's always been an issue, but I think this is heightened because everybody's paying attention. But I also think the PHE allowed states to have a real opportunity to figure out why ex parte rates were always low and how can we do better with the volume of work before us. So yes, they were low before. I mean, Missouri had relatively low ex parte rate prior. It's slightly better, but how can it continue to get better as we go through the PHE? What can we learn during unwinding to address all these issues that are really are problematic, but by the time we get to the end of the PHE, how do they look better?
Sure, absolutely. The other thing I want to make sure we dive into is, when we get into, probably the process and people and processes, is I want to dive back into this backlog piece, because I'm sure for folks listening in, and Melissa, for you and Jen, you're probably seeing it is some folks went into PHE unwinding with 10 to 30% vacancy rates, which means that for all this unprecedented work, you have folks that are fairly new. And so, well, do we train them on Medicaid first or SNAP first, or how do we get ahead of this? So I'll be interested to circle back on that and several slides ahead, if you all are willing, because we certainly hear that conversation in the places that we've been working lately too. So Jen, thank you for the national perspective. Can we move to the next slide, please? All right, so and we're gonna tackle customer communication first. And again, we're gonna have the pre and the post look at this. So next slide, please. So in our March 9th webinar, we talked about the things, about how customers are being communicated with, and some of the pre-unwinding tactics that the states were deploying were, they were finding every channel they could. So whether it was social media, all the websites, sending renewal forms, giving timelines. I know Missouri talked about, a handout they were sending to folks with, here's what to expect. I know too, the theme there was we cannot communicate enough to our customers. Flyer, that details that. And then there were many that were engaging in stakeholder and provider meetings, as Jen talked about a little bit, utilizing some of those partners out there to help with this. And so, Melissa, I just wanted to turn to you first and say, talk about the things that you were doing pre-unwinding and now that you're using. Please talk to us about how that's been working, any surprises you had, any shifting of gears around customer communication based on the first 4 months of unwinding you have had to make.
Thank you, Blake. We were using most of what we talked about in the previous one. We did the early opt-in, all the social media, the flyer, we did the stakeholders. What I will say is all of that has to continue, even though you may have done so much upfront and thought you did a great job, and you may have done a great job. It has to continue all the way through. So even though we've said early, often, and multiple times, we have to continue that all the way through the PHE unwinding. But I think it's also important that as we make changes or tweaks to our plans, we have to communicate those tweaks also, especially with our stakeholders and providers and advocates, because we've given them some guidance going into it, say this is how we're going to do it. And if we tweak that or change it even slightly, it's important to make sure our participants understand, but also our partners out in the community to understand, so they can help explain it and reinforce a message and reinforce what we're doing. So again, it's staying with it, but expanding it a little bit in the fact of any small tweak or change, we have to communicate often, all the social medias, all of our stakeholders and providers. I think that's one thing we've learned, is that the communication didn't stop or can't stop just because you did a month or two of annual renewals. It has to continue all the way through.
Okay, thank you. Thank you, Melissa. Jen, how about you from a national perspective? What have you seen that unwinding you thought were good ideas and working, and how's that still going? Are you seeing any of the states that you work with or CMS making any shifts?
I think Melissa nailed it as far as continuing it and not thinking, okay, we're done, since unwinding has begun. And especially that issue about communicating changes as well, because states are pivoting, they're responding to the data, they're making changes, and that needs to get out to both stakeholders and clients on the ground. The situation is evolving a bit as some of the publicity and notices go out as states have begun unwinding. So in some states, there's been a lot of news stories and coverage of people who have lost their Medicaid in the first months of unwinding. And while on the one hand, that does help get the word out that unwinding has begun, and it does matter if you return the form, unlike during the pandemic in some situations, There's also the risk that a bad message might get out there of Medicaid is closed. People are no longer eligible for Medicaid, or some sort of confusion if people hear about too many of their friends and family losing Medicaid. So I think that's something to watch for as well. The other thing that's been rather striking is the difference between these communication materials. We have seen amazing stuff from states, from coloring pages to social media posts to flyers and other forms of advertisement that tend to have a pretty clear and concise message. And that often stands in contrast to the state or county's notices that are sometimes just full of complicated policy language that doesn't even begin to clearly communicate to the client what's happening or what they need to do. Notices that have said, your Medicaid is ending, and then, oh, please send this back. Or you've been found ineligible. You've been found ineligible for one program, but eligible for another, but ineligible for another, and things. And we 100% recognize that this is complicated, that Medicaid policy is incredibly complicated, and what states are obligated to transmit to individuals is messy. But how can we take some of the lessons from these neat social media posts that get the message across clearly and apply these to the notices, using human-centered design, using methodology so that people actually understand what they have to do and are much more likely to follow up?
All right, well, thank you, Jen. And so far, I see several questions trickling in. And so please keep them coming. If anything comes up, or if you want to know more, let us know, because we will have time at the end to unpack some of these. So next slide, please. Let's move from communication to people and process. Now with people and process, I will say that this is something that's near and dear to my heart personally, around just processes around how can we put the worker, if it's not ex parte, or if it's not fully automatic, how can we put the worker as close to the person in need, the customer, as possible, to allow for that determination to happen as quickly as possible for both the person and their family, but for the worker to get the gratification that they're making a difference and moving the customer to the next step. And so if you go to the next slide, please. When we were talking about this, there were three questions really we were unpacking in the March 9th webinar. And that was one, how are you staffing to prepare for PHE unwinding? How are you organizing workflow to succeed? Has backlog been a factor in your planning? Because many states were going in with some backlog, some weren't, because some chose not to, they chose to continue their renewals through. And then if so, on any of these, how have you addressed this? And so in the pre-unwinding, what we heard from Missouri and Connecticut and from Jen was, contractors, they were basically staffing and preparing by a series of what can contractors do if needed and if we're allowed to, in our state. What can state staff do, and how can we create a hybrid model, to allow easy and quick access for the customers. Folks were utilizing navigators in community organizations. Also, they were talking about how do we utilize every access point. We know that customers, in a sense, get to choose, how they are interacting with us. So how can we make sure that we're fluidly addressing the access points that the customers choose? How do we get the experts situated to make those determinations as quickly as possible? Because at the time in March, there was conversation about that whole knowledge gap that we just addressed. If I've got vacancies, if I have a very inexperienced workforce at this point, how am I able to put the brain surgeons, so to speak, in the operating room to make sure there's a whole decision able to be made? And then folks talked about staggering. How are we going to unroll throughout the year, or is it 6 months, or at what points in the year are we going to do this? And then there were the retraining needs for the staff that had never done the renewals. So want to hear, Melissa, first from you. in terms of what you went into, March or into April, having planned for the year in advance around these areas, and then now 4 months in, how it's going for you? What you would change? What you have been changing? What's been surprising, or what's been, that we were on that one, but this one we needed to shift. So I'll turn it over to you before we go to Jen.
Sure, thank you. So I will say the one that popped out the most on that pre-unwinding that we discussed was that special retraining. I think we thought it would be much easier to kind of quote unquote retrain staff how to do annual renewals and ex partes. And I don't think we put enough thought and effort and thought through what staff would really need. I mean, you just forget how to do something when you haven't done it for 3 years. And for those staff that came on that had never done it, it's a whole new concept and a whole new way to look at things. So I think we had to kind of take a step back, and we have to reinforce that retraining of annual renewals often. We're seeing that, we thought we did it close enough to when we start that it would sink in and everybody would get it. But I think we just have to keep continually reminding staff on how and what we expect and what it looks like. I also think I think it's important to be honest with your staff on what's on the horizon. We were just, every state's dealing with, a gap in staffing, but in Missouri, we almost doubled. We were very close to doubling our Medicaid population with basically the same amount of staff or less. So I think it's important to tell your staff, wow, we've got a lot in front of us. We can do this together, but this is what the picture looks like. And that helps them kind of see what's on the horizon, but also to help them connect it to, this is a family I've helped, right? This is a person I've helped. Obviously, you have to adjust your process, and that kind of goes back to what we thought was good for retraining or guides or SOPs on how to do an annual renewal. We have to continually adjust those to meet the needs of what staff are struggling with, or what did we miss, and take advantage of all the flexibilities. We really leaned into that in Missouri, all of the flexibilities. I can't say we won't have a backlog, but to try to reduce it as much as possible. I think that's just honest talk. There may be a backlog for most of us, but how do you keep it to the smallest amount possible, and shifting your resources throughout the day? That's one thing Missouri's really tried to do over the last month or so, is where are our hot spots before they get to be a fire? Where can we shift some resources to really do that targeted, and then move to other hot spots so that we don't end up with a huge backlog or a fire to put out?
Melissa, can I ask, in the shifting, sometimes that is a new concept for staff. How do they take that? If I'm, working back office, and all of a sudden, hey, you need to take this phone call, or hey, I need you to do this. How do you all deal with the staff being okay with that? Because I'm sure that in the midst of all this busyness, sometimes it's hard to shift gears.
Absolutely, and it is hard to kind of shift your priorities and say, okay, now I need you to do this, or now let's work on processing or whatever. It's rough in the beginning. We, had a lot of like, what is going on? Why are you doing this? You're interrupting my day. How am I going to get my work done? But that goes back to be honest with staff regarding where we are, what's on the horizon, and say, this is why we have to do it. And they will eventually, it becomes a little more second nature. It's rough in the beginning. The first week or two is kind of, wow, the staff feel uneasy. They don't know what's going on. But when you tell them often, this is why we're doing it, and this is what we need to address now so that we don't end up in backlog later, that helps ease the nerves, and it does help kind of get everybody on the same page, because ultimately we're all here to help. We're all here to help families, and when you can explain and take it back to the why, I think it helps a lot. We've made a lot of progress in the last week or so on staff buying in and going, okay, I'm going to have to change and shift, and that's okay.
Okay. All right. Well, thank you, Melissa. Jen, how about the national perspective?
I think the people issues are just as we expected. States struggling with understaffing, struggling with newer workers who may not be familiar with the renewal process and some of the complexities inherent in Medicaid. But really, the question this begs is, where are we putting the burden of Medicaid renewals? Are we putting it on the client by sending them confusing notices and requiring them to mail in forms, even if we know that they continue to be eligible? Are we requesting additional verifications from them that we could get through electronic data sources? Are we putting the burden on the eligibility workers who, as Melissa very clearly said, are overworked and overburdened and don't have the capacity to handle everything that's coming at them? Are we making them do kind of mundane tasks and requiring them to complete a paper renewal on an SSI recipient that we know continues to be eligible? Or are we saving their time and expertise for complex cases and people who need their attention and might need a little more hand-holding or guidance through the process? So I think that's the big question in this process, and this whole thing is where are we putting that burden in the process, and we can make better choices here that protect everybody and really put the burden on the system rather than the system putting the burden on the clients and the workers.
Yeah, in the long run, that typically creates more work. It seems like.
Yeah, when you think about churn, you know, as you're saying, the churn, you know, the people who are procedurally denied and have to reapply. A new application is much more burdensome for the client and the caseworker. You look at the ex parte renewals when it's not done by the system, how much extra time it takes for the individual and the eligibility worker to process that. So there are some key points that are being exposed through Unwinding that can be addressed. ACA rules and regulations actually set up a pretty streamlined eligibility determination process, relying on electronic data wherever possible, reasonable compatibility. And when states maximize that, you see a much more efficient process. When states aren't taking full advantage of that, you see that burden, that backlog, that burnout, all of those things that just kind of spiral down into kind of dysfunction that really costs enrollees and workers.
Yeah, we had some data at some point where we talked about if we don't allow a worker sometimes to go on and finish, you know, a case or put them in the position to do that, it actually adds an hour to the entire process and 2, 3, 4 more contacts. And so it makes a lot of sense to again to put the worker in that decision. But it sounds like the theme of this topic is fluidity, right? And how we maximize our eligibility worker time. But looking at the clock, and I want to add, make sure we have time. We've got about 20 minutes left. I want to make sure we have time to address questions, which now there are a few more questions. So next slide, please. Let's move on to technology and systems. And next slide, please. So the question that we asked in March 9th of our participants was, what innovative technology solutions are agencies using to navigate redeterminations? And so at that time, from Connecticut and Missouri and from Jen, we heard about, the big talk was, how do we increase passive renewals? How do we, work towards ex parte? There was a lot of work I know Connecticut had been doing for that. And Connecticut was even partnering with their healthcare exchange for what about the handoff of those that did not qualify for a renewal, so that they don't go without healthcare. There was talk of bots and RPA, client portal system dry runs in the time, just really drilling, preparing for the unwinding. Missouri talked about bundling of electronic verification to help triage through something called their insights engine. So now let's see where we're at, from Melissa, again, you, and then Jen, what you're seeing. So Melissa, how was your planning? Where have you been surprised? How are you shifting gears, if you are?
Great. So our planning, I think, was ambitious. I'm not sure we were able to do everything we wanted, and I think that's just, we all have high hopes. We're like, oh yeah, we're going to get all this done. We all know technology sometimes takes a little bit, and states struggle with technology or procurement or just a whole myriad of issues that we have to address. I think we're getting very close to have some really good information out of our insights engine to help with, like, let's secure all those electronic verifications and do those ex parte so that we don't have to reach out. It is less burden on the participants and on staff. We're very close. We started using insights engine for our applications. Now let's lean into for our annual renewals. So just using that, and as I said a couple slides, what it looks like in the first and second month of PHE Unwind, I don't think is what it's going to look like at the end. I think we will definitely learn and grow. And Insights is just one of those tools that we are really going, I think will be a totally different tool once we get to, month 10 than it is today. I'm excited about it. We just keep adding more verification sources to increase the ex parte renewal rate that we have, but also even if you can't ex parte it, to give the participant a little more information and say, okay, here's what I found. It may not be, I may not be able to ex parte, but here's what I found in my electronic sources. Do you agree? It's less cumbersome on the participant to say, here's what I have, here's the information I have. You tell me if that's right, right? Instead of saying, go get me the information, here's the information I have. So that's one of the things. I think it just takes us longer sometimes to get through all of our technology, but there's some great options, and I think we'll just look totally different in month 10 than we do right now. And that I'm excited about. I think we'll look a lot better.
Yeah, well, and I think what we're seeing nationally, at least with our clients, is that this is such an unprecedented time. It's such a time where it used to be you could solve a lot with process, or you could solve a lot with technology. I think what we're facing now is one thing alone doesn't do it, right? And so we only have a finite number of workers. So what I'm so interested in is what states are doing, with technology to figure out how do we, again, maximize the time that their fingers need to be on the key, that they need to be voice to voice, with a client walking through something. And so, Melissa, thank you for that. Jen, tell us what you're seeing nationally.
Yeah, it's definitely a work in progress. As Melissa was describing, the fact that we have this period of unwinding and beyond to continue making progress and iterate and improve is the attitude that all states should have, and I think all states do. We are seeing some basic shortcomings in the technology and systems that are problematic. Even though regulations have required for about a decade now that people be able to renew online and by phone, we're seeing a large number of states who do not allow those avenues. And that's something that needs to be addressed. Sometimes that's a complex solution. Sometimes that is more simple or more about staffing and redeploying that. But good to see attention to those issues and kind of CMS oversight and pushing states to comply with those requirements. And then a lot does come down to ex parte and what states are doing, the rules they've set up. I think as more people have looked under the hood and examined rules engines and what's programmed into the system, we're finding some key areas of missed opportunity that's affecting people. For example, we're finding a number of states that are ex parte on the household basis rather than the individual basis. So if the income is too high for the parent, the whole household gets kicked out, even though the child might continue to be eligible. So that's very problematic. That's leading to a lot of procedural disenrollments among eligible kids. But now that we know about it, we can identify the states that have that issue. We can address it. We can share solutions across states. Similarly, on the non-MAGI side, the age, blind, and disabled has historically been left out of the ex parte process. But states that are paying attention to it, great folks in Minnesota, I saw Laura on from Olmsted, tremendous work in doing kind of a manual ex parte process where the workers are trying to do it before sending a form out, and really, really high success rates there. Just heard of great non-MAGI rates out of Connecticut as well. And I think that is really shifting the narrative from how non-MAGI is difficult and the assets are a problem to, hey, non-MAGI can actually bring up your overall ex parte rate if you do it well. And don't we want to keep on elderly and disabled people who are unlikely to have a change during their eligibility period? And so how do we leverage that technology and systems to really facilitate access from clients and streamline things, keep eligible people enrolled and take burden off of caseworkers?
Okay, thank you, Jen. And we have a few more questions coming in. So let's move to the next slide real fast. And Melissa and Jen, if you wouldn't mind, I kind of want to combine the last two together, just so we can jump over to the questions. But the last two have to do with both data. So how are we tracking data? And I've seen some really wonderful dashboards popping up through the states, you know, in terms of following them. And people say I have a sickness, but I do like looking at those a lot and just going through their data. But the other question too was any policy and budget decisions, you know, you had planned for or are making now in terms of waivers. So if you both could talk to, you know, how are you tracking and reporting to CMS and to your stakeholders and everybody else, but also any policy and budget decisions that you found that you needed to make differently or waiver decisions. If you could address those, Melissa, both at the same time, I would appreciate it.
Sure. So yeah, I think this is probably the two hardest to kind of navigate through while you're in the middle of all the work that has to happen. I think just looking at the data, understanding it, leaning into where the issues, where is this number acceptable, where is this one not, really understanding it. I think Missouri's getting ready to put up a dashboard for Missouri specifically. That will be coming today or tomorrow. So that puts it in perspective for Missouri. I think that's important for that transparency and for everyone to see. But also, you know, how to navigate, you talked about like policy and legislation. Those are big too. Missouri has a very active legislature, so sometimes it kind of runs counter, but so how do you navigate that? That is a huge list. And just saying, you know, don't blow up our unwinding plan just because you want to make this one little change. You know, talking about it and understanding what the ramifications are of policy changes or legislation, and showing the impact in a numbers way too, because numbers are easy to see and understand. So to me, these are the two hardest for me. It just seems to be a struggle to explain and make everyone understand, especially if you're not in this business and you don't live and breathe it every day. I think it's important to be transparent, you know, like it says down here on the bottom, show transparency, show those dashboards, be honest about your numbers, say our ex parte rate is not where we want it to be, but this is how we are going to work to improve it. That's just one example of how you continually communicate, but also explain what an ex parte is to everybody, and especially stakeholders and legislatures and all those people who don't live and breathe this every day. And those kind of just go together, but they're also some of the hardest parts to deal with, in my opinion.
Okay, Jen.
The data is incredible. It's providing incredible insights into what's happening in a state, not just the CMS reports, but also the dashboards that are breaking down numbers by coverage category, by race and ethnicity, by zip code. I think there's going to be a tremendous amount of insight that we're going to be able to get from this detailed data reporting. But to Melissa's point, it's hard, it's complicated. Even on the CMS reports that ask the same thing of every state, sometimes it's hard to do apples to apples, and what happens to the backlog, and when is that going to be reported? So it's complicated and it's messy, but we need to work through that messiness and continue this data reporting throughout Unwinding and beyond, and this level of transparency to compare across states, highlight best practices, et cetera. And I think that also ties into a policy discussion of what's working right now and what needs to continue. CMS has been incredibly responsive to the needs of states and the needs of enrollees with offering E14 waivers and offering flexibility wherever in their power to deal with the crisis of unwinding. Well, what has made a tremendous impact during unwinding? And what of those need to continue past unwinding? And is that within CMS control, or do we need support from Congress to make those changes? But there's so much learning going on, or there's so much natural experimentation. And how do we really take advantage of that and leverage it to make adjustments now, mid-unwinding, as well as make sure that these good practices continue beyond?
Thank you, Jen. I appreciate that. So we are running near the end, and I want to get to some questions. But first of all, I want you to know that we're going to put up the email list of folks that were on this webinar here in a minute, so that if you want to ask Melissa more about what she said, or Jen about what she said, or me, feel free to reach out to us. Also, while we are starting to get into questions, know that if we don't get to your question in our follow-up, we're going to send out the answers to your questions. But I want to dive into those right now. Bob Schmidt asked, when head of household re-registers, is it understood that the children in the household are also included, or are the children missed? I don't know who wants to take that.
I assume that's related to if one person from the household submits a renewal form, is everybody renewed? And generally, yes, there are some complications where states might not have everyone in the household on the same renewal period. We're also seeing situations where states were deprioritizing certain people with high medical needs and other things, but somebody else in the household came up for renewal earlier and they got pulled in. So most states are doing the renewal on a household basis and including everybody on a single form, but it's important to open all mail and respond to all mail, because sometimes for various reasons that is separated a little bit.
Okay, thank you, Jen. And Bob, if that didn't quite address it, please feel free to put in the chat and we'll follow up with more later. Moving on to the next, and if you all would too, while we're getting through these, if you would leave any key takeaways that you got from this so that we can make sure that we're seeing if this was useful or not, we would appreciate it. But Sam Reed asked this question. He said the KFF survey data showed that many recipients were not aware they could be unenrolled from Medicaid, and subsequently, they reported that 74% of disenrollment was because of procedural issues. This leads one to believe that states didn't do enough to educate the public on disenrollment. What do you think the cause of this is?
It's clear from that survey that a lot of people were not aware of what was coming. That survey was done, I believe, in March before Unwinding had actually begun. So it'd be interesting to see what awareness is right now and what knowledge is. And I think it just goes to Melissa's point of the outreach needs to continue. The communication needs to continue. And we need everybody to know that they're going to get a renewal form and they need to send it back, or they're going to be automatically renewed. I think we need to dive deeper into the procedural terminations. Why did people lose coverage? Again, did they not receive the notice? Is an address issue? Did they not understand it? Is the notice too confusing? Did they think that they weren't eligible anymore, or think that their benefits would continue if they didn't return it like it did during the pandemic? Or did they send it back and was it a problem on the state or county end that led to loss of coverage? So there's a lot more investigation needed into that.
I'll agree. I think especially for households who came on during the PHE and we didn't do any renewals, it may just be loss of this is something I have to do. If I receive this, I have to return it. So it goes back to communication, I think.
Okay, thank you. Sumat Anand asked a good question. Do lower ex parte rates lead to higher procedural terminations, or are they two unrelated?
Generally, they are connected. It does depend how you measure procedural termination rates. There's kind of a question there. But if more of your eligible people are kept on through the ex parte process, then there's a lower chance that eligible people will not receive a form, not return it, have it not processed by the agency. It doesn't matter if you measure procedural terminations as a share of overall terminations or overall renewals. It's important to look at it as a share of overall renewals to kind of capture those different ex parte rates. But generally, higher ex parte rates is a key way to bring down procedural termination rates.
Got it. Okay. All right. Thank you. And then Elizabeth Cerrillo said, communicate the why. And I don't know if that's a yes, communicate the why, or if she wanted us to know the why, but we can unpack that in the follow-up. An anonymous attendee said, who is the provider of Insights Engine and how does it work? I will say that's an uncomfortable question because Change and Innovation Agency is the provider of that, but Melissa, I don't know if you want to talk about that or not.
So yes, I think it's Change Innovation is the provider of that, but it really bundles everything so the worker does not, number one, can go quickly through an application or annual renewal because all of the electronic verification sources are right there in front of them. We've done a lot of tweaking in Missouri, like what kind of comments, case notes do we want for each kind of case. There's a lot of specialty like tweaks you can make to it and really provide a very customized option for every state, but it It streamlined the process, which means it's less burden on the participant and the worker. It moves faster so that more are done, so that it doesn't create a backlog. If you can move faster through a case, it really just brings in our unemployment, it brings in Equifax, it brings in all of our verification sources into one location and serves it up as basically, here's the file you're going to need to process this case. I know that's very high level and very generic, and I'm sure Blake and I would love to talk about it more if somebody wants to delve in and email us about what a little more specifics.
Sure, thank you. But it really is just serving up the data. How do you get the worker what they need to maximize their time? We have 3 more questions here that we're going to have to answer via follow-up, because Sugar's looking at me here that like we need to wrap up. But what I want to say to all of you who stuck to the end, thank you so very much for joining us. I need to thank Melissa and Jen for their participation, continued participation in this. What I want to let you all know is when we follow up, you will get the slides and you will get the answers to the questions unpacked, here. So we'll reiterate the ones that we sent. But also any of us are an open book. So feel free to reach out during the next webinar that we're going to be hosting on this topic. It'll be several more months out. We are going to get a county perspective into the next one too. So watch for those participants, because we know that not everybody is just state administered. And so we want to make sure we're paying attention to those folks. So, Minnesota, North Carolina, Colorado, California, others. So if there's nothing else, I'm just going to say thank you once again. And we'll look forward to continuing the dialogue as we go through, and best wishes to all of you.
Yeah, thank you all. And thank you to our presenters, Blake, Melissa, and Jen, for sharing your valuable insights during this wonderful and vital conversation as we continue to feel the impact of COVID-19. I know we're at time, so I'm just going to keep it brief. Thank you to the audience for coming. It's wonderful to see you all here. And this is the end of the webinar, but it's not the end of the conversation. So I really look forward to seeing how the discussion progresses. The recording for the webinar will be sent to the registrants, and it will be posted on the webinars page of the APHSA website. So thank you all again for joining us, and have a great rest of your day.